When times get dark, we can't see the help that's all around us. When you don't know where to turn, let 211 be your guiding light.
How can I help you?
Our guides are ready to connect you with the help you need. For help with food, healthcare, mental health, and other resources. Call 211 or visit 211.org. 211. Get connected, get help.
Welcome to Project Community Connect's panel on 211. My name is Mary Ann Floto and I work in Community Impact. 211 is a free 24-hour helpline that provides information about social health and government resources. Today, we are fortunate to have representatives from United Way Worldwide, 211 Maryland, and 211 Virginia, who will answer any questions you may have about this free service. Our first speaker is Joshua Pedersen, who is a 211 director at United Way Worldwide. Josh has worked and volunteered in the nonprofit industry for more than 25 years. He led the implementation of 211 service throughout Utah, served as Director of Services for the Utah Food Bank, was Vice President of United Way of Northern Utah, CEO of United Way of Frederick County, Maryland, and President and CEO of 211 Maryland. Welcome, Josh.
Thank you so much, Marianne, and thanks for having me here today. I'm so happy to talk a little bit about 211. My first slide, I just want to give a quick overview about the 211 service. The 211 service is more like a guiding light to help people find or navigate their way among the many hundreds of thousands of programs and available services out there. It can be pretty confusing to find which nonprofit or which government service might help. And so 211 provides expert caring help to navigate those services. In some ways, we're a little bit like a GPS or a spotlight to say, hey, here's the best way to go. Let me guide you to that program or service. 211 is kind of the front door to the many other programs that might be available in a local community. It doesn't always provide the direct service. We don't always typically pay for like rent assistance by calling 211, but 211 is that connector. It's that vital community connector to help you get linked up to the appropriate program. At 211, we triage a person's situation, kind of ask some additional questions, find out what they're looking for, and then make that connection to community services. Across our country, 211 services collectively maintain a database of all those different nonprofit programs, as well as the public health and human service agencies. We know which services are available, some of their eligibility requirements, when they're open or operating, where their names and addresses and all those different things are. Collectively, there's about 950,000 of those programs and services nationwide. And the best thing about 211 is we're locally based, and so you can get connected to which services are local in your community. So let me take you to the next slide and look backwards to how 211 came about. After World War II, when service individuals were coming back from World War II, they were looking for services and programs that they might be qualify for. And that's when these information programs really started to pop up. Sometimes it was in a library, but it came across as an information and referral service. And during the 60s, 70s, 80s, and even into the 90s, these hotlines were set up across the country where people could call a toll-free number and ask different questions about what services they might qualify for or be eligible for. We wanted to make that easier. And that's where the idea of 211 came about. In 1997, the phone number changed and they said, hey, let's make this easier. Instead of making it 1-800-HELP-NOW or 1-800-GET-THIS or that, they just changed the phone number to 211. And that's where the idea was born, was in Atlanta, Georgia in 1997. It was officially designated by the FCC in the year 2000, and today over 96% of the population has access to just that 3-digit telephone number 211. It's a free call for anybody looking for help, and today there's about 240, 250 211 services across the United States, and even in Canada. Some of those are located inside of a United Way. Some of them are inside of a nonprofit. Some of them are inside of a government entity. They look and feel all a little bit different, but they're located in your local community and help people get connected to those resources. So little quick snapshot. The next slide shows that there's 211s all across the United States. There's a couple areas of the country that in rural parts that does not have 100% 211 coverage, but we just wanted to show a quick sample there of that you can pretty much call 211 anywhere in the country. And if you're looking for 211 service, maybe you pick up the telephone and dial it in your community, but you're looking for help in another state where you're not located. If you need to find that, you can simply go to 211.org and type in your zip code or that state or that county where you're looking for and find their local website and their local information, because perhaps you're looking for someone or a service in another region or another part of the country to help somebody else, and they're not close to you. And so that's the best way to find it. But it is available across the United States and Canada. So just a quick snapshot about our impact at 211. On the next slide is that our network responded to about 20 million requests for help last year via telephone, texting, email, web chat, and we connected people to about 28 million different connections or services that are available in those local communities. This is a significant increase, and the reason for that is that 211 really played out as a significant service during the COVID pandemic. So many communities said, hey, if you need help with symptoms information or testing information or even vaccine information, you can pick up the phone and dial 211, and many 211s played that role. Informally, though, 211s have always been there to help people with rent assistance and housing and healthcare programs and food. And so 211, of course, played a very significant role during the pandemic because all of those services were affected by COVID. Whether a person lost their job or were seeking help with food or couldn't get out to the food bank or food pantry themselves, 211 played that critical role to help people get connected. And the next slide shows kind of that impact of how the numbers changed significantly between 2019 and 2020. And I share this for a couple of reasons. One, there was a significant impact. And if people had questions about COVID, they should pick up the phone and dial 211. They can often provide some very basic information and let you know where your local health department is, or if there's testing or vaccine access in your community. But the other reason I share this slide is to also show the scope of services that 211 can provide or connect people to. Sometimes we have questions about mental health or healthcare or dental care or preventative care. 211 is the place to call to kind of get you started in that journey. Most of our calls are obviously related to housing and utility assistance, but we also know that we need help with things like transportation or legal and public service help. All of those services are available by calling 211. As I mentioned earlier, we curate information and have information in our databases of about 950,000 services and programs. So this is just a sampling of the top 5 requests during the last couple of years, but 211 is available across our community for a variety of reasons. And the next slide, this is, I just want to give you a brief snapshot before we turn the time over to our colleagues in Maryland and Virginia. Our 211 team care. They are, as I mentioned, a critical link or navigators to help people get to an appropriate service. But our 211 team, they're trained. They want to talk to you on the telephone. It's not this automated press 1 for this or press 2 for that. And put you through a maze of recordings. We want to talk to people on the telephone and get to the root of the problems. And we'll ask additional questions to say, hey, what's going on here? So we can get you connected. They've been trained They go through certification processes before they ever even answer the phones. They go through a training process and a lot of work to make sure that they are a caring, trained professional when they respond to that call. Our 211 specialists in some communities across the country, we speak 29 different languages. We've got people on staff that speak many native languages, but in addition, we can access interpretation services. So if you're calling about 211 or referring somebody to 211 in a non-English language, that's okay. We want to make services barrier-free and accessible. As I mentioned, 211 played a pretty big role during the COVID pandemic. We distributed funds, we helped people with direct assistance, and we even have a partnership with Lyft and DoorDash where we were delivering meals and getting people transportation to different programs. It's not available in every community, but in your local community, we invite you to call 211 and talk to that caring specialist to help you get connected to the resources that might be available. I'm so happy to be joined by a couple of those caring and leaders from our local communities today, and I'll turn the time back over to Mary Ann to introduce them.
Thank you, Josh. Our next speaker is Kenyn Banjamin, Operations Director for 211 Maryland. Kenyn has worked in the nonprofit sector for over 18 years. He's the former Deputy Director of Bridges to Housing Stability and has extensive experience designing and implementing programs to prevent homelessness. Kenyn has also served as part of a social research team to reform educational services to disadvantaged youth and improve access to substance abuse treatment for drug-addicted adults. During Kenyn's remarks, you will listen to calls between a 211 operator and a caller from Maryland. Welcome, Kenyn.
Hello, and thank you, Mary Ann, for the introduction. Thank you, Josh, for your presentation on 211. I am here to give you all an overview of 211 Maryland. Next slide. 211 Maryland is a nonprofit organization. We view ourselves as the central connector. We help those with unmet needs by linking them to essential health and human service resources that they need to achieve a stable life. Next slide. As you can see, our work is based on partnerships. 211 Maryland is a statewide network of critical partnerships. Losing any one of these partnerships would mean losing a critical aspect of the work that we do. These partnerships allow us to respond to information and referral needs, allows us to respond to mental health, substance abuse, and suicide crises. We are able to send statewide disaster alerts because of these partnerships. We're able to provide community resource access to service providers as well as the general public. And we're able to analyze unmet needs and resource needs across the state, whether it be by zip code, county, or by region, all because of the partnerships that make up this statewide network. Next slide. These partnerships are at the core of our most common work, and that work being the calls that are coming in through our call centers. We have partnerships with 4 call centers providing information and referral services, and 5 call centers who are providing behavioral health crisis services. The efforts of these call centers cover every single county and city within the state of Maryland. Each call center is properly trained and have national accreditation through either the American Association of Suicidology or the Alliance of Information and Referral Services. Next slide. The effort of the call centers are supporting close to 500,000 calls, texts, and web chats in this past fiscal year. This is across 23 primary categories of need, with the majority of these contacts being related to information and referral needs. And as Josh pointed out in terms of the impact of COVID on the type of needs that have been presenting within Maryland, we are seeing a steady increase of housing and utility related needs. 211 Maryland is that one point access that connects those with unmet needs to their essential resources that they need to become stable. Next slide, please. From all of those contacts that our call centers are receiving, we are able to receive very critical information about unmet needs, what resources are commonly used, as well as resources that are underutilized. And we're able to take that information, to analyze it, and help to inform what programs should potentially exist at 211 Maryland, or be able to use that data to provide to legislators and supporting the needs of their constituents. Next slide. What you will hear next is a sample of real calls and real specialists as folk are attempting to address or get answers to support their housing crises.
211 Maryland, this is Valerie. May I help you?
I'm currently in danger of being homeless.
I'm calling because I needed some assistance with my rent.
I have past due balance due for my rent.
I'm in a panic, and I have rent coming up, and I'm worried. I just don't know what to do because I've been reading the new stimulus that's coming out. I'm self-employed PUA, so they said that there's no more, I'd have to like refile or something, but I don't know what to do.
I was trying to see if I could get some information on some programs perhaps that could help me with that.
I'm calling because it said for rental help to dial 211, so that's what I was calling for.
Are there any resources or programs that you know of that could help me pay rent?
So I knew if I got behind in my rent that I would be so far that it would be like a kick-out situation. And I've never been late. I'm a good 6 years I've been here. And I was just like trying to get help through. I had to like sell, my stuff and my kids' stuff to try to make ends meet. And so it's, when I get $50, I have to see like, okay, should I pay
buy food?
the $50 for the light, or should I pay the $50 for the rent? But then I pay $50, and then by the time the bill's due, it has like another late fee, and then it's like I never pay them their $50. So it's like, I have to like battle and feel like, oh, what's more important this month? Like me keeping my light, or
It's okay. This is something that I don't think anyone could have prepared. You just don't. You can't fathom this.
Yeah, sure. So we're an information referral service, so I'll have to give you a couple of different numbers that I think can help you out with the rent.
There are programs that are helping some with back rent that, there may be assistance available to you.
All right, thank you so
Okay.
much. I appreciate your help.
You're welcome. Take care of yourself, okay? All right.
Thank you.
You're welcome. Bye-bye.
You all have been so kind and so helpful. I've called you many times. And so, and you really have. That's not just hey, can you help me more? You really have, and I want you to know it
You
matters.
take care, and you call us back if you need to, okay?
All right, thank you.
Absolutely. Bye.
What our call specialists are doing as they are supporting those, as you heard on that call, is not only listening to hear how they might support the need, but also providing a sense of encouragement and providing support through a caring voice over the phone. As folk are calling us, and one of the sometimes most desperate times of their lives, our call specialists are there really to help calm them. And you could hear that through the audio that you just heard. One of the other critical aspects of 211 Maryland is our resource database. And what you see on this slide before you is the front page of our website. But right on that front page, we're asking, how can we help? And it is right on this page that anyone who has a need, anyone can type in 211md.org, land on this page, type in that they might need food or housing or support for a family member, put in their zip code and do a search. And the information that comes back when they hit search is the same information, the same resources that our call specialists at 211 Maryland have access to. The same information that you could get by dialing 211 in Maryland, the same resources that a specialist might provide for you are the same resources that you could actually access right through our website. The resource database is a core component of the work that 211 Maryland does. Not only are we able to support the general public through our website, but we're able to link and have linked our resource database to other websites, one being to support the Governor's Office on Crime Control and Prevention. We've linked our website to, or linked our database to their website to be able to provide resources to those that may be exiting correctional facilities to help them with the creation of reentry plans. Next slide. Some other important work that 211 Maryland does that still falls under our information and referral side of our work is a partnership with the Maryland Department of Emergency Management. Through that partnership, 211 is able to send out critical push alerts related to disaster or any threats that might be known to the state. Right now, we have over 205,000 subscribers to this texting platform, which is called MD Ready, and anyone can access it. Simply texting MD Ready to 211 MD1 gives anyone access to alerts right at their fingertip for any disaster, including information or updates related to COVID-19. Next slide, please. Another critical piece of the 211 work is our crisis work. And what you're about to hear are some of the crisis calls that we receive through our centers.
211 Maryland, this is Valerie. May I help you?
Yes, ma'am. I have rent coming up, and I'm worried. I just don't know what to do. Just exhausted. I've been trying to lower rent. It's too high here. I'm not going to be able to afford it. I'm sorry. It's just so much.
Yeah, that's okay. It's pretty stressful. You know, another thing, this has nothing to do with finances, but, you know, if you need somebody to talk to, there's a phone counseling program that you might find useful called the Pro Bono Counseling Project, if you want that number.
Okay.
I'll have that for you in just a second.
Well, thank you so much.
You're very welcome. Yeah, you take good care. And if other questions come up, feel free to give us a call back, okay?
Hi there, good afternoon. My name is Mike. I'm calling you back from 211 Maryland, United Way Helpline.
Hi, yes. I was calling to see if I could get some information on some assistance that I could receive.
Okay, I'd be happy to take a look and see what programs are available.
I'm already like so deep in a hole, like in debt, that even when I get that money,
It's gonna be
like I'm
gone.
not even going to see it.
Right.
Like I owe, some of my family, some of my friends. I had to like sell, some of my stuff and my kids' stuff to try to make ends meet. And Lord,
Yeah, here at the 211 United Way, we've recognized like mental health, the stress that this puts on everyone. There is a free counseling line that we have, and you can call it at any time just to talk. It really, I find it helpful for myself to because when I listen to someone else what they're going through, I'm like, wow, I get strength from their story. I'm getting strength from you right now, just hearing how you're still making it through. It makes me realize wow, this is a strong person.
The 211 Maryland Crisis Line is also called the 211 Press One, formerly known to be Maryland Crisis Hotline or Maryland Crisis Connect. This is a partnership that we have with the Maryland Department of Health, Behavioral Health Administration. It is an easy service that is accessible either by dialing 211 and pressing 1, or by texting 898-211, texting your zip code to that number, 898-211, or by going on to the 211md.org website and engaging in a web chat with one of our specialists. Through either one of those means, you are able to connect with a caring 211 specialist to share what crisis or feeling you might be having, and have that call or text message conversation or chat conversation be anonymous. But you'll receive whatever resources you might need, even if it's just a matter of not receiving resources at all, but just having someone to listen. These services are available in English and Spanish and 150 plus languages. So it does not matter where you're from, what you speak. We are here to support you no matter what. Next slide, please. In addition to our 211 Press One service, we have recently launched a new program that is focused on suicide prevention, and that is our 211 Health Check program. This is a program that allows you to receive a weekly check-in call, all to support your mental wellness. To enroll in this program, all you have to do is text the word health check to 211MD1. You'll immediately be connected with 211, be asked a few questions so that we might have a number to call you back. And you will then engage in weekly contacts with the 211 specialist, just checking in, just to find out how you're doing and give you an opportunity to talk if you need to, or provide any type of resources that you might need to support your mental wellness. Next slide, please. And then the last bit of the crisis work that 211 Maryland provides is through texting, just general behavioral health support via text. We have and are supporting over 3,000 Marylanders in their mental health needs by text. There are 3 programs that we have right now that are supporting this effort. One is MD Mind Health. This is another partnership with the Behavioral Health Administration. By texting MD Mind Health to 898-211, you'll receive weekly text messages that are full of encouragement, support, and providing resources. They're focused around avoiding negative self-talk, showing yourself kindness, practicing compassion, focusing on the present. This project was started at the height of the pandemic as people were dealing with social isolation. And this was a way to help people begin to feel more connected and to provide encouragement as people dealt with the complexities of this pandemic. The second program is MD Hope. This program is focused solely on those that might be dealing with opioid-related challenges. By texting MD Hope, a family, a friend, or even you, if opioid use is a problem, you can receive treatment recommendations, referrals to different programs, places to dispose of any drug paraphernalia or drugs themselves. And you receive biweekly affirmations. Again, another way to encourage healthy living. And then the last texting program to support behavioral health is MD Wellness. And this is through a partnership through the University of Maryland. By texting MD Wellness to 898-211, those who are in the helping profession can receive strategies and resources to help them manage stress through mindfulness, by reminding them of good nutrition habits and social affiliation. Well, these are just a few of the ways that 211 Maryland is helping to support mental wellness, as well as providing resources to those that have information and referral needs through under the Health and Human Service category. Thank you. Well, I will turn it back to Mary Ann to introduce our next person.
Our final speaker is Mary Ellen Hutcherson, Regional Community Engagement Specialist for 211 Virginia. Mary Ellen promotes 211 and its services to state and local governments and nonprofits. She also coordinates 211 Virginia's emergency preparedness and management services to local governments in Central, Northern, and Western Virginia. Mary Ellen serves as the co-convener of the Fairfax County Reentry Council and is on the Health Advisory Committee of Higher Horizons Head Start. Following Mary Ellen's remarks, you will listen to a call between a 211 operator and a caller from Virginia. Welcome, Mary Ellen.
Thank you, Mary Ann. It's a pleasure to be here. And I'm going to talk to you a little bit about 211, what we do. I have some programs that we are actively involved right now through the pandemic, and give you information on how to contact us at 211 Virginia to search for any resources that you need. Next slide, please. So just like you've heard from 211 Maryland, our job is to connect people to resources in their community. And those resources are anything that a person needs to live on a daily basis. So it's housing, food, clothing, financial assistance to pay utility bills, employment, anything that a person needs to live. We have listings on our database for your community, and you call us and we can help you find those resources. We are 24 hours a day, 7 days a week, 365 days a year. We are always there. There are always live people to answer a call from you at 211 Virginia. Even if you call us at 2 o'clock in the morning, you can call us Christmas Day. You can call us in the middle of the week during work hours. We're always there. There's always going to be a live call specialist to answer your call and help you search for those services. We also do provide translation into more than 200 languages. So someone just has to identify the language that they want us to translate into, and we can get a translator on the line with them immediately. And we do have bilingual staff that work answering our calls every day, so they'll be able to help them if someone is a Spanish speaker. Next slide, please. So basically, this is how 211 Virginia works. So we get all these calls on a variety of topics. It says, I can't pay my rent, I need food, I can't pay my electric bill. So they come into 211 on a daily basis, And our job is to help you find those resources in your community. And that's what we do. So if you need help to pay your rent, we can provide resources for rental assistance. If you can't pay your electric bill, we can provide resources for utilities, et cetera. So our job is to take your needs, put that into our database, and find out what resources are going to be available to you. Next slide. So right now we have a little bit more than 20,000 listings in our database, and our listings come from federal, state, and local governments, nonprofit organizations, faith-based organizations, and we do have some for-profit companies that are listed on our database. Those companies are allowed to be listed with us if they have a free or sliding scale and have a written policy about that. And what that means is that they provide services based on someone's income. And if they do provide that, then they are allowed to be part of our 211 Virginia database. If they do not provide that, then they're ineligible to be part of that. Generally, for-profit companies that are included are places like drug and alcohol treatment centers, hospital, counseling services, stuff like that, where their services are based strictly on how much a person earns, and that's the determination of how much they pay. Next slide, please. So our year runs July 1st through June 30th. And so from July 1st, 2020 through June 30th of this year, we received and responded to almost 170,000 requests for resources, either by phone, email, chat, text messages. Those are the number of requests that came into us, which was a significant increase over the year prior. Probably close to 40,000 additional requests came in just during that time period. Next slide, please. This is a breakdown of where our requests come from across the state. We are a statewide service, so we cover every single county and city in the state of Virginia with one database. And so you can see where our largest number of calls basically come from Central Virginia, which is Richmond, and then down in the Norfolk, Virginia area, although Northern Virginia had the largest increase in the last 2 years and account for almost 20% of all of our calls come from Northern Virginia. We do get a number of out-of-state calls that come in for people who are seeking services for someone who lives in Virginia, and that person may not necessarily live in Virginia, and we're happy to find those services for them as well. Next slide, please. So these are our top 10 needs and number of requests, and housing and utility assistance are number 1 and 2. And they are number 1 and number 2 every month, year after year for 211 Virginia. It is the 2 largest areas of assistance that we do provide. And because of COVID, our top 10 is a list that we haven't seen ever before. We've never had healthcare as the number 3. Healthcare meaning that included information on all COVID related issues. So that was health departments, how to social distance, vaccine information. Now we're doing booster information. So that jumped to number 3 in our list, and some of these other information services is number 9. People were looking for how to get as much information on services out there as possible. We are set right now to maybe surpass this last year's numbers because we still see that the need is increasing and is still there. Next slide, please. So this is a program that 211 was involved in, the Virginia Rent Relief Program. Back in June of 2020, the governor of Virginia declared a rent and mortgage relief program for those who were at risk for eviction, and simply because they weren't paying their rent or mortgage. The mortgage part of the program stopped in December of 2020 and was taken over by the federal government, but the state of Virginia still has a rent relief program, and it's still in effect. And there is funding to go through 2022 through June of 2022. So if someone is still unable to pay their rent, they can still apply for that. There's still significant funds available for anybody that needs rent relief. And what happens is you have to have a COVID-related reason for applying for rent relief, such as you were laid off, your hours were cut, you got sick, a family member got sick, etc. And if you do meet the requirements for the program, you're eligible for 15 months of back rent and 3 months of further rent. So you can go back till 2020 if you apply today and apply for 15 months back, and then you can get it up through the end of the year for that rent relief program. All Virginians are eligible for this program regardless of their citizen status. So if you are an undocumented person in the state of Virginia, you are still eligible to apply and receive funds for this service. So somebody can call 211. We're going to ask you just 3 or 4 questions to see if you're eligible, and then we'll provide information on how to go about applying for that online. If the person is not eligible for some reason, so for example, they didn't pay their rent in January and February of 2020, the program didn't kick in until March of 2020, we can't help them through the rent relief program, but we do have other programs available that can provide rent relief through local programs, local governments, and local nonprofits. Next slide, please. So for rent relief, you have to apply online. This is the web address for that, and you can go ahead and fill out the application and get that started. The Virginia Poverty Law Center has set up an eviction hotline. It was actually started before the pandemic started. And what it is it's a hotline staffed by attorneys from all across the state of Virginia who can provide a person with information on their legal rights to prevent eviction. The state of Virginia enacted multiple new eviction guidelines in July of this year that went into effect July 1st. And those are to protect a person from illegal eviction. And they can tell you all about that, how to go about to prevent the eviction, what a person needs. The only thing they cannot do is actually represent a person. They're not there to represent a person, but they can provide referrals to legal services and pro bono attorneys. And that is their phone number. They're there to help you. As I said, it's all staffed by attorneys. And they'll walk you through the requirements to do an eviction in the state of Virginia. Next slide, please. Another program to come out during the pandemic to assist families is the broadband benefit by the FCC. And what that does is it helps families who are struggling to pay for their internet. It provides $50, up to $50 a month off of their internet bill with their provider. If a person is eligible for the program, that $50 automatically comes off their bill from the internet provider. The funds go directly to that provider. There is also a one-time discount of up to $100 to purchase a laptop, tablet, or a desktop computer. That is one-time discount per family. If a family has 3 children that need laptops, it'll only do $100 for this a single purchase. This is an income based program, so you have to meet income guidelines. At this point, there is no end to the program in sight. There has not been a deadline set. So that $50 would, if you qualify for the program, that $50 will just come off your bill every single month until the program stops. And that is the website there that you can apply for the program. It's just a simple application online, and you can go ahead and they'll tell you right away if you're eligible or not. Next slide, please. As the number of people dying from COVID increased, FEMA set up a funeral assistance program to provide funeral assistance to anybody that has a COVID or a COVID-related death in the United States after January 20th, 2020. So the program is available for individuals up to $9,000 per individual who has died, and that will cover funeral services, interment, anything funeral related, caskets, a burial plot, etc. There is a maximum allowed of $35,500 per state. And what that means is if you have various number of people in a family that have died, you can receive up to $35,500 per state. There's a limit of $9,000 per individual. So 3 children cannot apply for the same benefit for one parent. However, those 3 children can apply on behalf of a parent, a grandparent, an aunt, an uncle, a child, etc. There is no income requirement for this program at all. They will not ask information on income, and it is not required to get the assistance. You do have to have some type of documentation that it was a COVID or COVID-related death. And that includes a death certificate, a notarized statement from a doctor or a medical examiner or a coroner, something like that, but you do have to show that. And then you will need to provide receipts for the funds that you paid out for the funeral services. So those are the requirements. The other thing is that you can only apply by calling. There is no online application. So you have to call FEMA Monday through Friday from 9 a.m. to 9 p.m. And that is the phone number there. I will tell you they're getting thousands and thousands of calls a day. You will need to be patient. You may need to hold on for an hour or so until somebody comes on, but that is the only way that you can apply for this. They do not have any online application available. Next slide, please. So those are some of the programs that we're actively involved with right now. And if somebody has additional questions, they can call us and ask more about that. And so we have multiple ways that you can connect to 211 Virginia. And of course, that dial the number 211. Yep, that's the way you do it. You dial the number 211. Or we have a toll-free number there, and that toll-free number is good both in-state and out-of-state. And the reason we have a toll-free number is if someone's cell phone does not connect to 211 Virginia, and that tends to be the pay-as-you-go phones that you can buy at Target and Walmart, they don't necessarily connect to 211. You can dial that 800 number, and that connects directly to us, just as if you were dialing the 211. You can also text us. You can just text the word connect and to 24/7-211. One of our call specialists will receive that text, and they will provide you the exact same information as if you called us or if you went to our website, and you're just going to get it in a text form. We also have chat on our website, and you can also request email if for some reason, let's say you're working with an elderly parent that needs information, and you feel more comfortable having all that information printed out on a piece of paper, we will email you that information about the services that you're requesting, and that will be sent directly to whatever email you provide to us. Our website is 211virginia.org, and you can go on there and look for the exact same services as if you were calling us. Next slide, please. This is our website. It is a brand new website. We just got it. It is a lot more user-friendly. And as you can see, those are the categories of our top requests. You just click on that, put in a zip code, and you can find out whatever resources you need. Again, you can hit the chat button. You can chat with a call specialist if you can't find what you're looking for, or if you're just not sure exactly what it is you need, they're going to be there to help you. And there's your email link or the text number. There's also a button at the bottom there that says that you can have it translated into Spanish right on the screen. Again, these resources are the exact same thing as if someone had called us. And please know that we are more than happy to help you if you were calling on behalf of somebody else. About 50% of our calls are somebody calling on behalf of somebody else, whether it be a parent, you're calling for an elderly parent, if a parent is calling on behalf of a child, et cetera. We are happy to provide you the exact same information that if that person was calling us directly. In reality, we don't really care who you are. Our job is to find you what resources that you need in order to help you get past whatever situation you're in right now. And so right now, I'm going to have a phone call, an actual phone call that came into 211 Virginia in the last year. And it is answered by one of our call specialists. And you can see here actually how we handle our calls, the information we provide, and how we're there to help. Just give you a little bit of a disclaimer. The information provided in the call is not necessarily applicable to today's situation. This is a sample of how we do this. Although this was an actual call, it was back in 2020. And so some of the information is not available today that was presented into the call.
Thank you for calling 211 Virginia. My name is Trey. How can I assist you today?
Hi, how are you doing? I'm actually calling on behalf of somebody else that's unable to call from their phone. But I just wanted a little information, if you could help me out before I give them the number to reach out to you yourself, if you could help me with that.
Okay, go ahead.
Okay, so what the case is back when the COVID started back in March or so, she's a healthcare worker, and she had lost her job due to the COVID. So she's pretty much for the past 3 or 4 months, she's been paying her rent with her credit card. And so she's about 2 months or 3 months behind right now. I don't know the exact amount, but she had told me today that she received an eviction notice from her landlord giving her 5 days to be out of the house. So I haven't really got a chance to talk to her, but I was wondering if this is a program that does help out with people that are struggling financially from the COVID, and that is this something that she could call to receive help herself and give you more information?
It is, sweetie. She can. I'm sorry that she's having such a hard time, like so many other people. But yes, she could call. We are a statewide organization for Health and Human Services, so she could definitely call about her rent. Now, the 5-day pay or quit is just that. She does not have to be out in 5 days. Okay.
Okay, good.
So reassure
good.
her of that. Mm-hmm.
Okay.
Please tell her that there's still a court process that has to happen, which means they give her the 5-day pay or quit. She does not pay in 5 days, so then the landlord has the right to go to court and start the eviction process, which normally takes about 30 days. Okay.
Okay.
Now
good.
the next
All right,
thing
that
is.
gives me some relief.
Oh, I'm sorry. Mm-hmm.
No, sorry.
Yes.
Sorry. Go ahead.
So then the next thing I was going to say is she may want to consider, she definitely needs to call, but they do have something, and you can write this down if you'd like.
Okay.
It's called it's CDC declaration, and it's she can Google that online, and should be a website that will come up that will allow her to print off a form that can stop the eviction process as long as she answers the questions. There'll be questions that she needs to answer before she signs that form, okay?
Okay. I think I saw that. I was clicking on links, and I think I had seen that form.
Okay.
I didn't download it, but I think I ran past it before I called you all to see if there was anything else that I could do before I called.
Okay.
So I think I'm familiar.
Right. I would highly recommend her doing that, presenting the landlord with that after she signs it, but it has to be true to the best of her knowledge. No false information, or she can turn around and have a criminal charge filed against her. But if those questions are answered truthfully, then that declaration will apply for her, and hopefully the landlord will accept that and stop the eviction process, okay?
Okay.
Now, I'm sorry. Go ahead.
No, I was just gonna ask you. So, along with that you had said the 5 days, is that something? So, if she is able to come up with, I don't know how much you know about the whole legal process behind it, but I had seen something to where that the courts had said that not until the beginning of the next year of 2021 that nobody could be evicted from their residence. Is that something that is true?
Well,
or
no. Well, if she does this form, that would take her through to the end of December. So that would be accurate.
Oh, cool. Good. Okay.
With this form. But then she still needs to call resources. So I just wanted you to know that she could go ahead and print out this form, answer the questions, and if the questions are all answered, that they as they apply to her, then she can sign this form. She needs to keep a copy of it and give her landlord a copy of it.
Okay.
Now, if her landlord fights this form, because technically, because the form is so new, they really don't have to accept it, but they don't know that. So if she fights it and says, I'm not accepting that, I'm still going to court and I'm going to go through with the eviction. Okay. Allow her to do what she's going to do, because, at the end of the day, because they have not done enough I guess this form is still so new that they haven't, they're not making the landlords take it. But we've had some success. Some will take it and because they don't know. And, it would be great, because then that would give her to the end of December to get caught up and then maybe be able to stay there. Right. And the next thing is we have resources that could maybe help her pay her rent, but then she does need to call in. We get a little more information from her. We enter it into the database, and then we get her those resources so she can start calling immediately to see if she can get some help and get caught up and stop having to put it on her credit card.
Okay, good. Awesome. That's such a great release. Thank you so much for that. And I'll definitely have her call you. So that's great information. I really appreciate it.
Her convenience, we're 24 hours a day, 7 days a week. So she can call and speak to any community resource specialist, and we'll be more than happy to assist her with that, okay?
Awesome. Thank you all for all you do. It's really awesome what you all are doing right now. So I appreciate it.
So
and thanks for your help.
You're so welcome.
Yes,
you be safe. Bye-bye.
If you have questions, you can contact 211 at any time. Ask us your questions. If you don't understand how something works, or if you don't understand where you can find the information, then we are happy to answer your calls. And if you are calling, let's say, from Fairfax and you need resources in Richmond, you can tell us that and we can go ahead and find all those services for you. If you don't really know what you're looking for, ask us that. We're happy to walk you through the process. If you have more than one need, if you need help paying your rent and you need help paying the electric bill and you need food, let us know all of that. We want to find you as many resources as possible, and we can do all of that in one call. Our job is to help you, and we are here to help you 24/7. Thank you for your time. Marianne, thank you.
I'd like to thank the speakers for a very informative presentation on how to use 211. It was really, really outstanding. Every day, United Way National Capital Area receives calls from residents in search of emergency assistance. And I think that these demonstration calls will help some of our callers understand how to use 211, which is a free resource for everyone. Now we have a few questions that came in after we started. And I'll ask you as they come along. One question that frequently comes up is, Mary Ellen, someone was asking us how the operators, you have a statewide database in Virginia. How do the operators rotate the calls? How does that work?
So we utilize a cloud-based database. And so basically, it's just as if you were calling any other call center. The call comes in and it goes right into a queue. And so the next available call specialist will pick up that call. Our call specialists are scattered throughout the state of Virginia, so you don't know where you're actually talking to somebody, but we all use one database. So it doesn't matter where you are and where that call specialist is, because we all have access to the exact same information.
So we refer callers, we tell them that they need to know their zip code, so that when they call 211, they're asked about their zip code. And sometimes they'll say, well, I don't know, or I'm calling from outside, but the operator is usually able to figure that out.
Yeah, so we can search by zip code or county and city. That happens a lot if somebody's calling from out of state.
Yeah.
Let's say somebody is calling from New York and has an elderly parent in Fairfax County, and they say, I don't have any idea what their zip code is. We'll say, okay, Fairfax County. We can pull up Fairfax County and find it just based on that county. And a lot of times, if we have to, we will Google their address and find out if it. Sometimes services have very specific areas that they cover, residency requirements, et cetera. So we'll say, oh, we only cover through this area, through these zip codes. And that way we'll know if that person's actually going to be able to get that service. So we'll go a little bit further if they don't know that zip code. But yeah, county and city is good just to, yep.
Kenyon, what about 211 Maryland? The operators, they also have a statewide database.
That's correct. So all of our call centers are sharing one central resource database. And so it doesn't matter where the caller is calling from or what resource they're looking for, even if they end up having their call answered from a call center that's not in their specific region, we can still identify the resources that are closest to where they are.
Great. Well, I have another question for you, Kenyon. Montgomery County has, they use 311, but residents living in Montgomery County can dial 211. What happens to that call? Who answers it? Where does it go?
That's correct. So we have a partnership with a call center in Prince George's County, which covers the Montgomery County region. That call would direct to Community Crisis Services, Inc. They are a 211 Maryland call center. And so anyone in that Montgomery County region who dials 211 would have their call routed to that call center and would have access to all of the resources that are at the fingertips of 211 Maryland.
Great. Now this may have been answered in each one of your presentation, but I wanted to cover it again. If someone in the region, say they're in Virginia and they dial 211, they're trying to help a friend who lives in DC. Do the operators have access to the DC information?
Yes.
Sources.
So for years, we have been sharing our resources with DC and Maryland and vice versa. So if someone calls from Virginia and says, hey, I need services for DC, or mainly we do Montgomery and PG County, we can search our database and find what we have available and provide that information to them as well. We also have information on North Carolina and West Virginia. It's not as extensive as we have for Virginia, but we do have some. And then we're going to give them a toll-free number, DC and Maryland, to contact them to find out if they can help. But yeah, and because of our proximity, we get those calls frequently where somebody is just searching for information in another region of the state. And so, yeah, we're happy to provide that to anybody that calls.
Yeah. And Maryland is the same as Virginia. Because of proximity, we do have quite a few DC resources and can provide those resources if we need to do so. And because of the network under 211, we can always make contact with another 211 who might have additional resources for that DC resident.
So I just want to point out that DC has 211, but it's not the traditional 211. They promote 311. So if an operator, a caller dials 211, the call is directed to a 311 operator who then routes the call to the correct agency or a person who can be helpful to them and answer their information. So one more question, and this is for Josh. 211 has been doing such important work throughout the country. Can you think of areas where they could benefit from a more robust 211 program? Any cities in particular?
Right. So 211 is as good as it is, as their local employees are and their local team is, and that investment in a local community. And I would say every community that's investing in their 211 does a fantastic job. And they are doing all the 211s across the country do a fantastic amount of work with, even though they may have limited resources. And having said all that, I would say that there are some communities where we do need to invest more in 211, and we encourage local government or local elected officials or other philanthropic organizations to step up and say, you know what, 211 is the front door to every success story. It's the first chapter of every success story. It can get you connected to helping programs. It prevents the perpetuation of a problem by giving an earlier intervention and information early to individuals that need help. And it can also prevent the complication of a crisis, because we can mitigate what's going on and get people connected early on. So that investment is really important. And there are definitely some communities out there that need some additional resources to step up and help make those connections. And one thing that I like to remind everybody is that sometimes the answer is no when you call 211. There might not be available help. There might not be available services to everything. But call anyway, because we can at least start to track and say, hey, this is where the gaps are. This is where the needs are. So we can elevate the issue and draw more attention to it. I don't know if that answered your question, Marianne.
Well, it does. It does. Thank you very much.
Yep.
I just want to thank all of you for just a great presentation and information about 211. This presentation is part of Project Community Connect's week-long series of panels and workshops geared to those individuals and families on the verge of homelessness and working families who struggle financially to make ends meet. To register for Project Community Connect workshops, go to unitedwaynca.org/PCC registration. You'll also be able to access this panel discussion and others on United Way's NCA's YouTube channel.